Hi, my name is Gedelin Grisel Martinez, and I will be reading the chapter 5 to 13. Medical practitioners. 1. Practitioner. In Britain, doctors, also known as a medical practitioner, must be qualified, have a university degree in medicine. They must also register included in the General Medical Council list or register in order or practice. See Unit 13. A doctor who treats patients of opposite to one who only does research is called a clinician. A doctor who provides primary care for a patient is known as a general practitioner, GP, or family doctor. GP usually work in a group practice. Larger group practice work in a building called health center. Specialties. Specialist doctor, for example, pediatrician, generally work in a hospital. However, those who work outside the NHS providing private care, healthcare may have counseling run outside the hospital. For example, in the famous Harley Street in London, the two main branches of medicine are surgery and internal medicine, and the doctors who practice this branch are called surgeon and physician, respectively. In Britain, male surgeons are addressed as Mr. and family as Miss. So Dr. Smith is a physician and Miss Smith is a surgeon. A cardiologist specializes in disease of the heart and circulation or cardiology. A geriatrician specializes in disease of elderly patients or geriatrics. And anesthetics specialist in anesthetics. Note: name of a specialty usually end in ology. Name of a specialty usually end of ologist. If the name of a specialist end in ECS, the name of the specialist end in ECN. There are some spectrum, e.g. anesthetic and anesthetic. Choosing a specialty. Jill Matthew has just graduated from a medical school and is talking about her future. I haven't decided what to specialize in yet. I need more experience before I decide, but I'm quite attracted to the idea for pediatricians because I like work with children. I've certainly before to work with children, then say elderly patients, so I don't fancy geriatric. I was never very interested in the field anatomy, so the surgical specialty like neurosurgery don't really able. You have to be good with your hands, with with your hands, which I don't think is a problem for me. I've assisted in operations several times and I've even done some minor ops by myself. But surgeons have to be able to do the same thing again and again without getting burned, like trying off good artery and so on. I don't think that will be a problem for me, but they need to make decisions fast and I'm not too good at that. I like to have time to think with main surgery, probably not right for me. Note, collocation good is followed by a no. He's good with children. The collocation good at is followed by the eng or Jerome or the best or by a no. She is good at explaining procedure. Profesionales médicos 1. Médicos. En Gran Bretaña, los médicos, también conocidos como doctores, deben estar calificados, tener un título universitario en medicina. También deben estar registrados, incluidos en la lista del Consejo Médico General o registrado para poder ejercer. Ver la unidad 3. Un médico que trata a los pacientes de, en un lugar que solo investiga se llama médico. Un médico que proporciona atención primaria a los pacientes es conocido como médico general, GP o médico de familia. Los médicos de cabecera suelen trabajar en una práctica grupal. Un grupo más grande de prácticas trabaja en un edificio llamado centro de salud. Nota. El inglés británico, el verbo se escribe práctica con S y el verbo sustantivo se escribe práctica con C. Especialidades. Los médicos especialistas, por ejemplo, los pediatras, generalmente trabajan en hospitales. Sin embargo, aquellos que trabajan fuera del NHS, proporcionando atención médica privada, pueden tener salas de consulta fuera de un hospital. Por ejemplo, en la famosa Harley Street en London. Las dos ramas principales de la medicina son la cirugía y la medicina interna, y los médicos que practican estas ramas se llaman cirujanos y médicos respectivamente. En Gran Bretaña, los cirujanos masculinos se dirigen como señor y las mujeres como señora, por lo que el doctor Smith es un médico y la doctora Smith es cirujano. Un cardiólogo se especializa en las enfermedades del corazón, circulación o cardiología. Un geriatra se especializa en las enfermedades de pacientes de edad avanzada o geriatría. Y un anestesiólogo se especializa en los anestésicos. Elegir una especialidad. Jill Matthew acaba de graduarse de la Facultad de Medicina y está hablando de su futuro. Todavía no he decidido en qué especializarme. Necesito más experiencia antes de decidirme, pero me trae bastante la idea de pediatría, porque me gusta trabajar con niños. Ciertamente preferiría trabajar con niños que, por ejemplo, con pacientes ancianos. Así que no me gusta la geriatría. Nunca estuve muy interesado en la anatomía detallada, por lo que las especialidades quirúrgicas como la neurología no son realmente atractivas. Tienes que ser bueno con tus manos, lo que no creo que sea un problema para mí. He ayudado en operaciones varias veces e incluso he hecho algunas operaciones menores por mí misma. Pero los cirujanos tienen que ser capaces de hacer lo mismo y una y otra vez sin aburrirse, como atar las arterias cortadas y así. No creo que eso sea un problema para mí, pero necesito tomar decisiones rápidas y no soy muy buena en eso. Me gusta tener tiempo para pensar, lo que significa que la cirugía probablemente no sea adecuada para mí. Nota. La colocación buena es seguida de un sustantivo, es bueno con sus manos. La colocación buena es seguida por una forma de gerundio o ing. Exercise 1.2. Write sentence to describe the work of the specialist in each branch of medicine. Look at B opposite to help you. Dermatology. A dermatologist specializes in disease of the skin. Rheumatology. A rheumatology studies joint pain. Traumatology. A traumatology is specialized in traumatic injuries to the bones. Pediatrics. The pediatrics focus on the health of children from birth to adolescence. Obstetrics. The obstetrics specialize in the care of women during pregnancy and childbirth. Complete the table with words from A, B, and C opposite and relate form. Put a straight mark in front of the stressed syllabus and H word. The first one has been done for you. Specialize, specialist, specialty, practice. practitioner, practice, consult, consultant, consultations, assist, assistant, assistant, graduate, graduate, graduations, qualified, qualifications. Find preposition in C opposite that can be used to make word combination with the word in the box. Then use the correct form of the word to complete the sentence. A pathologist specializes in diagnosing disease through examining cells and tissues. A pediatrician must enjoy work with children. An oncologist is specialized in the diagnosing and treatment of cancers. A physiatric must be good at counseling. A neurosurgeon must be good with her hands. Make a word combination using a word from each box. Two words can be used twice. Look at A, B, and C opposite to help you. Consulting runs general practitioner, group practice, health center, internal medicine, surgical specialties. Chapter 6, Medical Practitioner 2, Hospital Staff. The people who work in any type of workplace, including hospital, are called staff. The medical staff in British hospital belong to one of four main groups. A pre-registration house officer, PRHO, or house officer, is newly graduate doctor in the first year of postgraduate training. After a year, he or she becomes the registered medical practitioner in the current system of training, the foundation program. The name for this junior doctor is Foundation Year 1 Doctor, FY1, see Unit 12. A senior house office, SHO, is in the second year of postgraduate training. The title is New Foundation Year 2 Doctor, FY2. But the old term senior house officer and SHO are still used. A specialized register, SBR, is a doctor who has completed the foundation program and is training in one of the medical specialties. There are also some not trained registered doctors who have completed their training but do not wish to specialize in yet. A consultant is a fully qualified specialist. There are many also to be associate specialist senior doctor who do not wish to become consultant. In addition, there is at last one medical or clinical director who is responsible for all of the clinical staff. Medical teams. Medical team. Consultant, physician, and surgeon are responsible of a specific number of patients in the hospital. Each consultant have a team of junior doctor to help care to those patients. In many hospitals, there are multidisciplinary teams which consist not only of doctors but also of physiotherapists and other elite aid professionals. See Unit A. When patients enter or are admitted to hospital, they are usually sent first by one of the junior doctor on the ward, where they will receive treatment and care. The junior doctor clerk them take their medical history, see Unit 47 and 40 to 49, and examine them. Something later, the registrar also see the patient and may order investigation or tests, for example, X-ray or ACG, make provisional diagnosing and begin treatment. The consultant usually sees the new admissions, people who have recently been admitted to the ward for the first time on one of the regular ward runs when the management of the patient is discussed with the registrar. Consultants also decide when the patient is ready to be discharged, sent home. On the ward round, the consultant is accompanied by the team and a nurse, and they visited all the patients in the consultant's care. Shifts. Junior doctors now normally work in shifts, which mean they normally work for 8 hours every day. For example, 7 a.m. to 3 p.m. and are there free until 7 a.m. the next day. After a week, they change to a different shift, for example, 3 p.m. to 11 p.m. or 11 p.m. to 7 a.m. The alternative shifting is to work from 9 a.m. to 5 p.m. every day and took turns to be on call, unable to return the hospital if necessary from 5 p.m. to 9 a.m. the next day. Days on call are set out in a rota or list of name and times. Doctor on call carry a radio pager or beeper, a device with make a noise when someone is trying to contact them. Exercise 6.1. Make word combination using a word from H box. Look at A, B, and C opposite to help you. Associate specialist, house officer, on call, provisional diagnosis, radio pager, and ward round. Match the description 1.5 with the job titles 8E. Look at A and B opposite to help you. Dr. Graham has been a pediatrician for 8 years and is responsible for treating the children admitted to Ward 60. Consultant. Dr. Stewart has just started the second year of her foundation program. HHO. Dr. Sykes has started his training as a surgeon, specialist register. Dr. Phillips has just graduated and is working in a large hospital in Birmingham. PRHO or house officer. Dr. Miller is in charge of the medical staff in the Birmingham Hospital. Medical director. Are the following statements true or false? Find reason for your answer in A, B, and C opposite. A medical graduate becomes registered 2 years after graduation. False. The system of training doctor in Britain is called the Foundation Program. 2. True. The name senior house officer is not longer used in Britain. False. The consultant is usually first doctor to see new patients. False. When working in shifts, all doctors take turns to be on call. True. Complete the test of a PRHO describing her job. Look at A, B, and C opposite to help you. When I get to the ward, the first thing I do is talk to the house officer who was on duty during the last shift to find out if there have been any new admissions. Then I generally see the shirt nurse. He tells me if there is anything to need to be done urgently, such as intravenous line to put or take down. Later in the morning, I clerk any new patient with basically involved taking a history. On Tuesday and Friday morning, the consultant does her ward round, and I have to make sure I'm completely up to the date or on her patients. After that, there are usually lots of things to do, like writing up requests for blood tests, and so on. In the afternoon, I have to prepare for any patient who are to be discharged the next day. They are usually happy to be going home. And then, of course, there are the lectures and tutorials in the foundation program on Monday and Wednesday. Chapter 7, Nurse, Nursing Grades. Nursing working in a hospital have the following grades. A student nurse, a nurse who is still in training, a staff nurse, a nurse who has completed the training course, chart nurse, a more experienced nurse who is in charge of responsible for a ward of department, nurse manager, a nurse who is in charge of several wards. Note, the old term system is still something using for a family chart nurse. A family nurse manager may be called matron. Dr. James is talking to Sister Watkins. Support workers. The clinical support worker who has done a short course and obtained basic qualification and the nursing auxiliary who is usually unqualified but assists nursing staff. There may also be work clerk, choose duty including making sure patient notes and information are up to date and answering the telephone. Specializations. Like doctor, nurse can be specialized. A midwife have a specialized for the beginning by doing a course of midwifery, the managing of pregnancy of childbirth. District nurse visit patients in their homes. Health visitor also knowing the community giving advice on the promotion of health and the prevention of illness. The nurse role. The nurse role has changed considerable in recent years. In admission to general patients are checking temperature, pulse rate, and blood pressure, changing dressing, giving injections, and removing sutures. Nurses now do some of the things previously reserved for the doctors, such as preventing drugs and ordaining laboratory tests. More responsibility for nurse is planned, as the following article demonstrates. Nurse carry out surgery in effort to cut patient waiting lists. Nursing is Scotland training to perform minor surgery having turned to opening thread on the first time in an effort to cut patient waiting time. 5 nurses who have passed a new course at Glowon Collins Caledonian University are now qualified to carry out such procedure and remove small lesions begin molds and sites. The verb perform carry out are used with the type of procedure. They are often used in the passive form. Perform an examination, perform an operation, perform a procedure, carry out an experiment, carry out a test, carry out a biopsy. The procedure was performed by nurse. The procedure was carried out by nurse. Grados de enfermería. Las enfermeras que trabajan en un hospital tienen las siguientes calificaciones. Estudiantes de enfermería. Un enfermero que todavía está en estreno. Enfermero jefe. Un enfermero que ha completado su curso de formación. Enfermero encargado. Un enfermero más experimentado que está a cargo o se hace responsable de un departamento. Gerente de enfermería. Un enfermero que está a cargo de varias salas. El doctor James está hablando con la enfermera Watkins. Trabajadores de apoyo. El trabajador de apoyo clínico que ha hecho un curso corto y ha obtenido calificaciones básicas y el auxiliar de enfermería que generalmente no está calificado, ayudan al personal de enfermería. También puede haber empleado de barrio, cuyas funciones incluyen asegurarse de que las notas y las informaciones de los pacientes estén actualizadas y responder al teléfono. Especialización. Al igual que los médicos, las enfermeras pueden especializarse. Una comadrona se ha especializado desde el principio haciendo cursos de obstetricia y el manejo de embarazo y parto. Las enfermeras de distrito visitan a los pacientes en sus hogares. Los visitantes de la salud también trabajan en la comunidad dando consejos sobre la promoción y la prevención de enfermedades. El papel de enfermería. El papel de la enfermera ha cambiado considerablemente en los últimos años. Además de la atención general del paciente, el control de la temperatura, la frecuencia de pulso y la presión arterial, el cambio de apósito y la inyección y la eliminación de suturas. Las enfermeras ahora hacen algunas de las cosas que estaban reservadas para los médicos, como recetar medicamentos y pedir pruebas de laboratorios. Se planea más responsabilidades para las enfermeras, como demuestra el siguiente artículo. Las enfermeras realizan una cirugía en un esfuerzo por reducir la lista de espera de los pacientes. Las enfermeras de Escocia capacitadas para realizar cirugías menores han entrado a un quirófano para el primer esfuerzo por reducir los tiempos de espera de los pacientes. 5 enfermeras que han aprobado un nuevo curso de Glasgow o Caledonia Universidad ahora están calificadas para llevar a cabo procedimientos como la extirpación de pequeñas lesiones, lunares benignos y quistes. Los verbos carry out y performance, que significan llevar a cabo, se utilizan con todos los tipos de procedimientos. A menudo se utilizan en forma pasiva, como por ejemplo, llevar a cabo un examen o una operación o un procedimiento o un experimento o una prueba o una biopsia. El procedimiento fue realizado, el procedimiento fue realizado por una enfermera o fue llevado a cabo por una enfermera. Complete the sentence. Look at B, look at A, B, and C opposite to help you. Someone who specializes in delivering babies is a midwife. Someone who is qualified to assist nurse is a clinical support worker. Someone who is not qualified but is able to assist nurse is a nursing auxiliary. A nurse who has qualified is a staff nurse. A nurse who specializes in health promotion is a health visitor. A nurse who looks after a ward is a church nurse. A nurse who works in the community is a district nurse. And someone who answers the ward telephone is a ward clerk. Make word combination using a word or phrases from each box. Look at the opposite to help you. Carry out the procedure. Change a dressing. Check the temperature. Give injections and remove sutures. Complete the sentence with the correct grammatical form of perform. 1. I saw the brain scan the painless and easy to perform. Biopsy of the pancreas was performed last March. If the patient's condition deteriorates, a laparotomy will be performed. If a diagnosis of meningitis is suspected, a lumbar puncture must be performed. Last year, we performed a randomized double-blind group study. Complete the sentence with the correct grammatical form of carry out. I now intend to carry out a large study. Unfortunately, few properly controlled trials have been carried out so far. A number of students have been carried out recently to look of the questions. Right hemicolectomy was carried out and the patient may have recovery. This procedure can be carried out in the emergency department. Allied health professionals. Community health. Health of the community depends on a large number of people other than medical practitioner or nurse. This can be grouped under the heading of elder health professional. They include the following: physiotherapy skills help people to move by getting them to exercise or by getting their body with threat of massage. Treatment by manipulation muscle and joint with the hands. See Unit 42. Occupational therapy, OTS, help people with a disability to perform tasks at home and at work. A disability is physical or mental condition that making difficult to live normally, for example, blindness or deafness. Social worker help people to solve their problem, for example, poor housing or unemployment or family problems. Chiropodists, also known as a podiatrics, treat condition affecting the feet. Technicians. They are numerous technicians, people who work with scientific equipment, such as radiographers, who are known as X-ray technicians, ambulance technician work in the emergency medicine service, an ambulance technician with more advanced qualification is called paramedic. Prosthetic and orthosis. Prosthesis and orthosis provide care for any who need artificial limb and prosthesis, or advice to support or control part of the body, and orthosis. They also advise on rehabilitation, helping patients return to normal life and work after treatment. Orthotics provide artificial replacement for patients who have had an amputation or were born without a limb. Orthoses provide a range of splints and other devices to aid movement, correct deformity, and abnormal development of part of the body. For example, clubfoot, talipes, and relief pain. Opticians. Optician test age sign and prescribe glasses, also known as spectacles and contact lens when necessary. The examination included measure intraocular pressure and pressure of fluid inside the eye, and examining the retina. If the optician suspects an eye disease, such as glaucoma, they refer the patient to their GP for treatment. The GP may then refer patient to an ophthalmologist, a doctor who specializes in disease of the eye. Profesionales de la salud aliados. Salud comunitaria. La salud de la comunidad depende de un gran número de personas, aparte de los médicos y las enfermeras. Esto se puede agrupar bajo el título de profesionales de la salud aliados. Incluyen los siguientes: Fisioterapeutas. Ayudan a las personas a moverse haciendo que hagan ejercicios o tratando su cuerpo con calor o masajes. Tratamiento manipulando sus músculos o articulaciones con las manos. Ver unidad 42. Los terapeutas ocupacionales OT ayudan a las personas con discapacidad a realizar tareas en el hogar y en el trabajo. Una discapacidad es una condición física o mental que dificulta la vida normal, por ejemplo, ceguera o sordera. Los trabajadores sociales ayudan a las personas a resolver sus problemas sociales, por ejemplo, la mala vivienda o el desempleo o los problemas familiares. Los quirópodos, también conocidos como podólogos o podólogas, tratan las afecciones que afectan el pie. Técnicos. Hay numerosos técnicos, personas que trabajan con equipos científicos, como los radiólogos, que son conocidos como técnicos de rayos X. Los técnicos de ambulancia trabajan en el servicio de medicina de emergencia. Un técnico de ambulancia con calificaciones más avanzadas se llama paramédico. Protestistas y ortopedistas. Los protestistas y ortopedistas brindan atención a cualquier persona que necesite una extremidad artificial o una prótesis, o un dispositivo para apoyar o controlar una parte de su cuerpo, una órtesis. También asesoran sobre la rehabilitación, ayudando a los pacientes a volver a la vida normal y al trabajo después del tratamiento. Los prostistas proporcionan reemplazo artificial para los pacientes que han tenido una amputación o nacieron sin una extremidad. Los ortopedistas proporcionan una gama de férulas o otros dispositivos para ayudar al movimiento, corregir deformidad de un desarrollo anormal de una parte del cuerpo, por ejemplo, el pie de sambo o talipes, y aliviar el dolor. Optometrista. Los optometristas prueban la vista y recetan anteojos, también conocidos como anteojos y lentes de contactos, cuando sea necesario. El examen incluye la medición de la presión intraocular, la presión del líquido dentro del ojo y el examen de la retina. Si el óptico o optometrista sospecha que una enfermedad ocular, como la glaucoma, remite al paciente a su médico de cabecera para que lo trate. El médico de cabecera puede derivar al paciente a un oftalmólogo, un médico especializado en enfermedades oculares. Exercise 8.1. Make a word combination using a word from a box. Look at A, B, C, and D opposite to help you. Ambulance, technicians, artificial limb, glove, foot, contact lens, health professionals, intraocular pressure, occupational therapist, and social worker. Which which elbow health professional will best help the following people? Look at A, B, and C, and D opposite to help you. A young unmarried woman who has just had a baby, social worker. A woman who is having difficulty using her right arm following a fracture, physiotherapist. Someone who needs glasses, opticians. An elderly woman who has had a below neck amputation, protestic. A man whose wife has Alzheimer's disease, social worker. A man with a fungal infection in his feet, chiropodist. Chiropodist. Complete the test. Look at A and C opposite to help you. A protestic worked with patients of all age as a member of the clinical team based at Alert Hospital. The patients may need a prosthetic as a result of the accident or amputation following a disease such as diabetes. Alternative, they may have been born without a limb. Orthotics work along the doctors, nurse, psychotherapists, or occupational therapists to give the people under their care the best possible rehabilitation. They may is to enable the patient to lead the normal life at work in leisures. And orthosists often work in the clinic as a part of the outpatient several and also visit other centers to provide a service for people with special needs. They deal with people of all age. For instance, children who have cerebral palsy may require splints to help them walk, and any other people need a special shoes to correct deformity. If damage any part of the human skeleton may require some form of orthosis. The orthosis may need needed the reposition the body of to relieve pain. Hospital. Introduction to a hospital. Jordi Pons is a fourth-year medical student from Barcelona. He has come to Britain on all elective attachment to the Royal Infirmary in the Burg. Dr. Baron is introducing him to the hospital. Dr. Baron. The Royal Infirmary is the name of the university hospital for Edinburgh University. It is a general hospital dealing with the type of the patient and illness, except pediatrics. We have a specialist hospital for that in another part of Edinburgh, the Hospital for Sick Children. You can see more of the departments in our hospital on the sign. Of course, there are many others, for example, the Intensive Care Unit, ICU, and the Surgical High Dependency Unit, HDU. Jordan, what does outpatient mean? Dr. Barron. Outpatient are the people who come to the hospital to attend a clinic or to have tests or treatment and then return home at the same day. Inpatients stay in the hospital for one or more days. The room where they stay are called wards. If a patient's treatment requires only one day, such as a simple operations, they can be admitted to the day surgery unit. Outpatients. Dr. Babram. The accident and emergency department, A&E, also called casualty, is where patients who are actually ill with a sudden serious conditions come for assessment and treatment. Outpatients who have an appointment to see a specialist go to the clinic in one of the outpatient department, OPDS. They have usually been referred to the hospital by their GP, who write a referral letter to the consultant explaining the patient problem. Inpatients, Dr. Barrow. The inpatient in a hospital are admitted in one of their main ways. They may they may be seen in one of the outpatient clinics and admitted from there, or if there is a lot of demand of the treatment they need, if a case of a hip replacement, they are put on waiting list for admissions. Alternative, their GP may arrange an admission by telephone calls they are currently ill, for example, with suspended myocardial infarctions, or they are sent in the A&E department, were the doctor on duty working at the time around the admissions. This will happen This will happen in the case of the patient with fractured neck or of femur, for example. Large hospital may have access units where patients can be admitted temporarily while their condition is assessed. Jordi, assessed? Yes. Decisions are made about their condition and what needs to be done to help them. After treatment is called, the patient is discharged to back to GP care. Hospitales. Introducción a un hospital. Jordi Pons es un estudiante de cuarto año de medicina de Barcelona. Ha venido a Gran Bretaña a un anexo electivo de la Royal Infirmary de Edimburgo. El doctor Barron lo está presentando en el hospital. Doctor Barron. La enfermería real es el nombre del hospital universitario de la Universidad de Edimburgo. Es un hospital general que se ocupa de todo tipo de pacientes y enfermedades, excepto la pediatría. Tenemos un hospital especializado para eso en otra parte de Edimburgo, el Hospital para Niños Enfermos. Puedes ver algunos de los departamentos de nuestro hospital en el cartel. Por supuesto, hay muchos otros, por ejemplo, la unidad de cuidados intensivos o UCI y la unidad de alta dependencia quirúrgica HD. Jordi, ¿qué significa paciente ambulatorio? Doctor Barro. Los pacientes ambulatorios son las personas que vienen al hospital para asistir a una clínica o a someterse a una prueba o tratamiento y luego regresan a casa el mismo día. Los pacientes hospitalizados permanecen en el hospital durante uno o más días. Las habitaciones donde se alojan se llaman salas. Si el tratamiento de un paciente requiere solo un día, como una simple operación, puede ser ingresado a la unidad de cirugía ambulatoria. Consultas. Doctor Barron. El Departamento de Accidentes y Emergencias, AIE, también llamado Casualty, es donde los pacientes que están gravemente enfermos con una afección repentina y grave acuden para ser evaluados y tratados. Los pacientes ambulatorios que tienen una cita para ver a un especialista acuden a una clínica en uno de los departamentos de pacientes ambulatorios OPD. Por lo general, su médico de cabecera los ha remitido a un hospital, quien escribe una carta de referencia al consultor explicando el problema del paciente. Pacientes hospitalizados. Doctor Barr. Los pacientes hospitalizados en un hospital son ingresados en una de las tres maneras principales. Pueden ser vistos en una de las clínicas ambulatorias y admitidos desde allí. O si hay mucha demanda para el tratamiento que necesitan, como en caso de un reemplazo de cadera, se ponen en lista de espera para la admisión. Alternativamente, su médico de cabecera puede organizar el ingreso por teléfono porque están gravemente enfermos, por ejemplo, con sospecha de infarto de miocardio o son atendidos en el departamento de AIE, donde el médico de guardia que trabaja en ese momento organiza la admisión. Esto ocurriría en caso de que un paciente con un cuello fracturado de fémur, por ejemplo, los pacientes más graves pueden tener una unidad de evaluación donde los pacientes pueden ser ingresados temporalmente mientras se evalúan a condición. Jordi, ¿evaluado? Doctor Barron, sí, se toman decisiones sobre su condición, lo que hay que hacer para ayudarlos. Una vez completado el tratamiento, el paciente es dado de alta de nuevo al cuidado del médico de cabecera. Exercise 9.1. Complete the table with word from A, B, and C opposite. Put a street mark in front of the street syllabus in each word. The first one has been done for you. Admit, admissions, access, assessment, discharge, discharger, operate, operations, preferred, treat, treatment. Make word combination using a word from each box. Look at C opposite to help you. Actively ill, assessment unit on duty, referral letters, and waiting list. Which hospital department will be most appropriate for the following patients? Look at A, B, and C opposite to help you. A woman in diabetic coma, intensive care unit. A patient who has just had a radical protectomy, high dependency unit. A patient who is to have a skin lesion removed, day surgery unit. A man with foreign body in his eyes, emergency. A woman with therapeutic abortions, accident and emergency department. Complete the strat form on information left to patients. Look at A, B, and C opposite to help you. When you arrive at the hospital, please tell the receptionist who will welcome you. Check your details and direct you to the waiting area. The length of your visit will be depend of the treatment you are going to have. You may need to you may need to have some tests such as X-ray with could mean going to another department, or you may be referred to another professional such as a physiotherapist or a dietitians. You may need to revisit the clinic. If a staff at the clinic want to see you again, another appointment will be arranged for you. If you need to be admitted to hospital for more treatment, either as an patient or for day, surgery will be told when this is likely to happen. If you do not need further treatment, you will be discharged to your GP care. Primary care. The National Health Service. The National Health Service, the National Health Service, NHS, is responsible for health care for everyone in the UK, although a small number choose to pay for private care. Treatment is the free, but there is a description discharge for drugs and appliances, such as cerebral flutter, with exemptions for someone patient who has children and the yearly. Primary care is provided by general practitioner or GPs, sometimes known as family doctors, nurse, dentists, pharmacists, and opticians. GPs work in practice of 1 to 20. Practice are based in a surgery and look after a health of the from 1,000 to 15,000 people in their local community. They also provide health education in areas such as smoking and diet from clinic giving vaccination, for example, for influenza, and may perform minor surgery, such as removal of wart of moles. If a patient needs special care, the GP will be make refer the patient to a consult in a secondary care. Patients are normally seen on the appointment basis. Home visits are made when patients are housebound, unable to leave their homes, or too ill to attend surgery. Out of hours OOH treatment from 6 p.m. to 8 a.m. is provided by the local primary care trust with organized chief of GPS and locums GPS to cover if someone is absent. Note, the NOM surgery has 3 minutes. The building where GPS worked, the practice have moved to new surgery on the High Street, a time when DPS patient were in surgeries from 8:30 to 12:30. The word of surgeons, the patient needs urgent surgery and a burst appendix. The practice 10. A typical GP practice employed receptionists. They are responsible of initial patient contact, making appointments, taking requests for repeat prescriptions, taking message from patient and other healthcare provider, and for filing and scanning documents into patient record. The practice manager has responsibility for finance and something for IT, supervise prescription staff, hires locums, and helps prepare the practice development plan. Practice nurse from asthma, diabetics, and cardiovascular disease clinics, as well as one-to-one clinic for those who wish to give up smoking. In addition to practice staff, GPs work with a number of health professionals. See Unit 8. District nurse visits temporarily housebound patients, such as recently discharged hospital patients to change dressing, such as ulcer dressings. Health visitor visit families to carry out checkups on young children, particularly under 5, to make sure they are healthy. Special attention is paid to families in need, such as those living in poverty. They also do baby immunizations. Midwives run clinic for antenatal patients. Physiotherapists provide hands-out treatment but also treat patients exercise they can do to improve their condition after accident or operations. GPS day. Dr. Stewart worked in a practice in a small market town with 3 other family doctors. The surgery is in the center of the town and is chaired by 3 practices. This is typical work morning when she is not the duty doctors responsible of emergencies and urgent problems. 8 o'clock a.m. Arrive at the surgeon. Check the OO email, print out, check for urgent and not urgent message. 8:30 a.m. Check emails from the health board and further prepare for surgery. 8:30 to 10:50 a.m. morning surgery, 10 minutes appointments. 6 pre-booked last week, 2 booked 48 hours ahead, 4 booklet on the day. 10:50 to 10:55 a.m. Check with reception for massage, sign prescriptions, and deal with repeat prescriptions. 11 o'clock to 11:20 a.m. Coffee break in the conference room with colleagues. 11:20 to 11:30 a.m., check home visit requests and device up visit with home visit. Atención primaria a la salud. Servicio Nacional de Salud. El Servicio Nacional de Salud, NHS, es responsable de la atención médica de todos en Reino Unido, aunque un pequeño número elige pagar por la atención privada. El tratamiento es gratuito, pero hay un, un cargo por prescripción para medicamentos y electrodomésticos como un collar cervical con excepciones para algunos pacientes como niños y ancianos. La atención primaria es proporcionada por médicos generales o médicos de cabecera, a veces conocidos como médicos de familia, enfermeras, dentistas, farmacéuticos o optometristas. Los médicos de cabeceras trabajan en prácticas de 1 a 20. Las prácticas se basan en una cirugía y cuidan de la salud entre 1.000 y 15.000 personas en su comunidad local. También proporcionan educación para la salud en áreas como el tabaquismo y la dieta. Dirigen clínicas, administran vacunas, por ejemplo, para la gripe y pueden realizar cirugías menores como la extirpación de verrugas y lunares. Si un paciente necesita atención especializada, el médico de cabecera hará una derivación, remite al paciente a un consultorio de atención secundaria y los pacientes normalmente son admitidos con cita previa. Las visitas domiciliarias se realizan cuando los pacientes están confinados en casas, no pueden salir de sus hogares o están demasiado enfermos para asistir a la cirugía. El tratamiento el tratamiento fuera del horario o OOH de 6 de la tarde a 8 de la mañana es proporcionado por el Fideicomiso de Atención Primaria Local, que organizan turnos de médicos de cabeceras y médicos de cabeceras sustituidos para cubrir a alguien ausente. Equipo de práctica. Una práctica típica de un médico de cabecera emplea recepcionista. Son responsables del contacto inicial con el paciente, hacer citas, tomar solicitudes de recetas repetidas o tomar mensajes de pacientes y otros proveedores de atención médica, y de archivar y escanear documentos de récord de paciente. Las enfermeras de práctica dirigen clínicas de asma, diabetes y enfermedades cardiovasculares, así como clínicas individuales para aquellos que desean dejar de fumar. Además del personal de práctica, los médicos de cabeceras trabajan con varios personales de salud. Ver unidad 8. Las enfermeras de distritos visitan temporalmente a los pacientes confinados en casa, como los pacientes de hospice recientemente dados de alta para cambiar los apósitos, como los apósitos de úlceras. Los visitantes de la salud visitan a las familias para realizar chequeos a los niños pequeños, especialmente a los menores de 5 años, para asegurarse de que estén sanos. Se presentan especial atención a las familias necesitadas, como las que viven en la pobreza. También hacen vacunas para bebés. Las parteras dirigen clínicas para pacientes prenatales. Los fisioterapeutas proporcionan prácticos, pero también enseñan a los pacientes ejercicios que deben hacer para mejorar su condición después de un accidente o una operación. El día de un médico de cabecera. El doctor Stewart trabaja en un consultorio de una pequeña ciudad comercial con otros 3 médicos de familia. La cirugía está en el centro de la ciudad y es compartida por 3 consultorios. Esta es una mañana de trabajo típica cuando ella no es la doctora de turno responsable de emergencia y responsable de emergencias y problemas urgentes. Exercise 10.1. Complete the sentence. Look at A opposite to help you. Children's over 60s and people with someone disease do not have to pay prescriptions charge in UK. Patients with mobility problems may be unable to go out. They are housebound. The average GP appointment is 10 minutes long. A locum is someone who takes the place of a staff member who is on leave. The care outside working hours is now as out of hours treatment. Make word combination using word or phrases from each box. One word can be used to twist. Look A and B opposite to help you. Change dressing, make appointment, perform minor surgery, prefer a clinic, run, prefer a patient, run a clinic, supervise staff, and take massage. Which member of practice team will be responsible of A of followings? Look at B opposite to help you. Running a clinic for pregnant women, midwife. Teaching a patient who to strengthen this broken leg, physiotherapist. Letting the GP know that the patient can't come to her appointment, receptionist. Running a clinic for people who want to lose weight, practice nurse. Visiting a patient who has just returned home after a hernia operation, health visitors. Carrying out check-ups on children in a poor neighborhood, practice manager, and organization cover for an absent doctor, manager, nurse. Complete the diary of Dr. Stewart afternoon. Look at A and C opposite to help you. 1 o'clock to 2 o'clock p.m. practice team meeting over sandwich lunch. 2 o'clock to 4 o'clock p.m. afternoon surgery, 12 10 minutes appointments. 4 o'clock to 4:20 p.m. coffee break. 4:20 to 5 o'clock p.m. check with reception for massage, dealt with home visit and repeat prescription requests. 5 o'clock to 6 o'clock p.m. prepare work, AG, referral to secondary care, admission task, telephone calls to patients, private medical examinations. 6 o'clock p.m., phones switched to OOH service. Medical education 1. Medical education in UK. Medical education in the UK covers undergraduate education, 4 or 5 year at medical school, the section of university responsible of medical educations. A 2 year foundation program which provides training for new doctor after graduation through a series of placement in different specialties. See Unit 12. Postgraduate training which doctors take to become GPS or consultants, senior specialists, often delivering through college for different specialty, for example, the Royal College of Physicians. Continuing professional development in the form of course and seminars with doctors undertake throughout their working life to keep up to date. Strat form and undergraduate prospectus. The MBCHB Bachelor of Medicine, Bachelor of Surgery is a 5-year graduate medical degree course. Most of your learning takes place in a small group. The main components are core, years 1 through 3, an integrated program of clinical and scientific topic mainly present through problem-based learning, PBL, where you work with others on a series of case problems, vocational studies, and clinical skills. These components prepare you to the clinical skills required to contact with patients from year 1 of your course through periods or practical training where you are attached to a hospital department or general practice. Students select models. Students select models SSMS allow you to choose from a menu of subjects such as sport medicine or even a student or language as prepared for an overseas selective and hospital attachment of your own choice between years 4 and 5. Clinical attachments, years 4 and 5. A series of 4-week clinical attachments in medicine, surgery, psychological medicine, child health, obstetrics, and gynecology and general practice. A student's view. Helen, a medical student, described her course. I'm just finishing my first year of medicine. What I like about this course is that you're involved with patients from every beginning. Even in our first year, we spend time in hospital. Much of the course is PBL. We have 2 years, 2 hours, 2 2-hour sections a week where we work in group of 8 of 10 solving clinical problems. We decide together how to take the problem, look at books and online source, make note and discuss the case together. It's a great way for learning and getting to know the other students. In the past, medical students led lectures with a whole class taking notes from lectures from 9 to 5. But now it's mainly group work, although we do have some lecture and seminars. We will work in a small group with a tutor. I like all of even disease. We get to cut up cadaver from the second month of the course. Educación médica 1. Educación médica en Reino Unido. La educación médica en Reino Unido cubre la educación de pregrado, 4 o 5 años en la escuela de medicina, la sesión de la universidad responsable de la educación médica. Un programa de fundación de 2 años que proporciona capacitación para nuevos médicos después de la graduación a través de una serie de colaboraciones de diferentes especialidades. Ver la unidad 12. Formación de posgrado que los médicos toman para convertirse en médicos de cabecera o consultores. Especialistas de alto nivel, a menudo impartida a través de universidades para diferentes especialidades. Por ejemplo, el Real Colegio de Médicos, desarrollo profesional continuo en forma de cursos y seminarios que los médicos realizan a lo largo de su vida laboral para mantenerse al día. Extracto de un prospecto de posgrado. El MBCHB, licenciatura en medicina, licenciatura en cirugía, es un médico de licenciatura en medicina de 5 años. La mayor parte de su aprendizaje se lleva a cabo en grupos pequeños. Los componentes principales son el núcleo de 1 a 3 años, un programa integrado de temas clínicos y científicos presentados principalmente a través del aprendizaje basado en problemas, PBL, donde trabajas con otros en una serie de problemas de casos. Estudios vocacionales y habilidades clínicas. Este componente los prepara para las habilidades clínicas requeridas para el contacto con los pacientes el año 1 de su curso a través de periodos de capacitación práctica en lo que está adscrito a un departamento hospitalario o una práctica general. Módulos seleccionados por estudiantes. Los módulos seleccionados por los estudiantes SSM se permiten elegir entre un menú de asignaturas como medicina deportiva o incluso estudiar un idioma como preparación para una elección de un extranjero. Un archivo adjunto hospitalario de su propia elección entre los años 4 y 5. Y por último, está el adjunto clínico de cuarto y quinto año. Una serie de apegos clínicos de 4 semanas de medicina, cirugía, medicina psicológica, salud infantil, obstetricia y ginecología y práctica en general. La opinión de un estudiante. Helen, una estudiante de medicina, describe su curso. Acabo de terminar mi primer año de medicina. Lo que me gusta de este curso es que estás involucrado con los pacientes desde el principio. Incluso en nuestro primer año pasamos tiempo en el hospital. Gran parte del curso de PBL tenemos 2 secciones de 2 horas a las semanas en las que trabajamos en grupos de 8 a 10, resolviendo problemas clínicos. Decidimos juntos cómo abordar el problema, buscar libros y fuentes en líneas, tomar notas y discutir el caso juntos. Es una gran manera de aprender y conocer a los otros estudiantes. En este caso, los estudiantes de medicina tenían conferencias con toda la clase tomando notas de los profesores de 9 a 5, pero ahora es principalmente trabajo en grupo, aunque tenemos algunas conferencias y seminarios donde trabajamos en grupos pequeños con un tutor. Me gusta todo, incluso la disección. Podemos ver cortar cadáveres desde el segundo mes de curso. Exercise 11.1. Match these activities to the state of medical education in the UK, given in a positive. Discerning cadavers, undergraduate, keeping a log of surgical procedures observed and performed, postgraduate, working for 4 months in accident and emergency to experience this specialty foundation program, taking a 4-week attachment in obstetric and gynecology, undergraduate, taking an online course or recent development in cardiovascular disease, professional development. Complete the sentence. Look at B and C opposite to help you. Just before their final year, students have the chance to take an elective in a hospital of their choice anywhere in the world. Problem-based learning contracts with a approach where each subject is taught separately. These state lectures are often interactive with regular opportunities for the student to ask questions. In clinical attachment, a student learn about to treat and manage practice patients. Student selective nodules can be a topic from outside medicine, such as foreign language. Dissection of cadavers is an important part of the anatomical component. The medical school at the University of Edinburgh is one of the oldest in the UK. She is a surgeon at the Royal, one of the leading pediatric heart specialists in the country. The Royal College of Surgeons in Edinburgh dates from 1505. We have a seminar each week where we discuss a topic in a small group with our lectures. Match is of things activity to one of the components of the undergraduate course described in B and C opposite. Yule spent 6 weeks working in a small hospital in the Himalaya. Oversee later. A group of students discussed together the possible reason for abdominal pain after meal in an upset 44 years old man. Problem-based problem-based learning. A small group of students tries the pulmonary artery in a cadaver dissections. Otto spent a month working in the pediatric ward of the local hospital, clinic attachment. Annie learned how to take blood from an elderly patients, clinical skills. And Yuma chose to study travel medicine in this fourth year, a student selective model. Chapter 12, Medical Education 2, the Foundation Program. The Foundation Program is a 2-year training program which forms the bridge between university level study at medical school and specialist or general practice training. It consists of a series of placements, each lasting 4 months, which allow the junior doctor, known as a trainee, to sample different specialties, for example, pediatrics. A year 1 training, FY1, correspond to pre-registration house officer, PRHO, post and a year 2 training, FY2, to senior house officer, SHO post. Each training have an educational supervisor who ensures that more senior doctors deliver training in different ways, including clinical and educational supervision. To progress, training have to demonstrate the rank of clinical competitions which are assessed through observation in their workplace. People in medical educations. Tutor, an academic or in some case of postgraduate student who leads tutorials. Demonstrator, in anatomy teaching, someone who demonstrates who to dissect. Demonstrator are often postgraduate students paying their way through medical school. Leader, senior leader, an academic with teaching and research responsibility who's contribute to the teaching or a particular discipline. Professor, a senior academic with teaching and research responsibility for a particular discipline, usually a leading figure of their discipline. College tutor, a consultant responsible for delivering a college training program. Clinical trainer, a consultant assigned to a training who provide training during a period of their clinical care. Educational supervisor, a consultant who supervise the trainer period of training. Medical qualifications. BMCS, BM, BMEDS, SCI, Bachelor of Medical Science, a degree often taken after 3 years medical studies by a student who may wish to follow a career in medical research. MBCHB, MBBS, MBMBCH, BMBS, Bachelor of Medicine, Bachelor of Surgery, Bachelor degree, or undergraduate degree. This is the first degree or UK doctor. MDDM, Doctor of Medicine. DRCOG, Diploma of the Royal College of Obstetric and Gynecology. MRCP, MRCS, Member of the Royal College of Physicians, Member of the Royal College of Surgeons. Doctor become member by successfully completing the assessment procedures in their college. FRCS, FRCS Ed, FRCS Class, FRCSI. Fellow of the Royal College of Surgeons of England. Other colleges are indicated by the letter with follow. For example, Edinburgh, Glasgow, or Ireland. How doctor becomes a fellow depends of their college. For the FRCS, further examination must be passed. For other college, is it by nomination or work assessment? Educación Médica 2. El programa de fundación. El programa de fundación es un programa de formación de 2 años que forma el puente entre el estudio y de nivel de universitario de la Facultad de Medicina y la formación especializada o de práctica general. Consiste en una serie de colocaciones, cada una con una duración de 4 meses, que permite al médico junior o joven, conocido como aprendiz, muestrear diferentes especialidades, por ejemplo, pediatría. Un año, uno de práctica, FY1, corresponde al puesto oficial de la Casa de Prescripción, PRHO, y un año 2 en prácticas, FY2, a puesto oficial de supervisor de casa, SHO. Cada alumno tiene un supervisor educativo que se asegura de que más médicos de alto nivel impartan capacitación de diferentes maneras, incluidas a supervisión clínica y educativa. Para progresar, los aprendices tienen que demostrar una gama de competencias clínicas que se evalúan a través de la observación en su lugar de trabajo. Personas en educación médica. Tutor. Un académico o en algunos casos un estudiante de posgrado que dirige tutoriales o tutorías. Manifestante o demostrador, más bien. Las enseñanzas de la anatomía, alguien que demuestra cómo diseccionar. Los manifestantes pueden ser estudiantes de posgrados que se abren camino a través de la escuela de medicina. Conferencista principal. Un académico con responsabilidades de enseñanza e investigación que contribuye a la enseñanza de una disciplina en particular. Profesor universitario. Un académico de alto nivel con responsabilidades de enseñanza e investigación para una disciplina en particular. Por lo general, una figura destacada en su disciplina. Tutor universitario. Un consultor responsable de impartir un programa de formación universitaria. Entrenador clínico. Un consultor asignado a un aprendiz que proporciona capacitación durante los periodos de atención clínica directa. Y supervisión educativa. Un consultor que supervisa el periodo de formación de un aprendiz. Cualificaciones médicas. BMSC o BMED-SSI, licenciatura de Ciencias Médicas, un título que a menudo se toma después de 3 años de estudios médicos por estudiantes que pueden desear seguir la carrera de medicina. MBCHB, MBBS, BMBCH o BMBS, licenciatura de medicina, licenciatura en cirugía. Los títulos de licenciatura son títulos de pregrado. Este es el primer grado para los médicos de Reino Unido. MD o DM, doctor en medicina. DRCOG, diploma de Real Colegio de Obstetricia y Ginecología. MRCP, MRSC, miembro de Real Colegio Médico o miembro de Real Colegio de Cirujanos. Los médicos que se convierten en miembros al completar con éxito los procedimientos de evaluación de su universidad. FRCS, FRSC, ED, FRSC Glass, FRSSI. Miembros del Real Colegio de Cirujanos de Inglaterra. Otras universidades están incluidas por las cartas que siguen, por ejemplo, Edimburgo, Glasgow o Irlanda. La forma en la que los médicos se convierten en becarios depende de su universidad. Para la FRCS se deben aprobar más exámenes. Para otras universidades es por nominación o evaluación del trabajo. Exercise 12.1. Complete the phrases with verb from the box. Two phrases can be complete in two different ways. Look at A and B opposite to help you. Demonstrate a competition, a competence, or how to do something. Supervise a training by ensuring the successfully complete her training. Provide a course or training program as a teacher. Take a course or a training program as a student. Assess progress or competence. Match the two parts of the sentence. Look at A, B, and C opposite to help you. And F1, FY1 is a director, D, in the first year of the foundation program. A demonstrator is an anatomical teacher who teaches the sections. A clinical trainer is a consultant who provide training during period of direct clinic care. A supervisor is a consultant. B, responsible for the training program of training. A medical school is G, part of a university responsible of medical education. A placement is C, a period spent as a trainee in a hospital of the general practice. A college is a body of a specialty responsible of delivering and decision training in their specialty. A fellow is a specialty E, who has reached the interest level in their specialty. Write in full the qualification of the doctor and surgeons. Look at the opposite to help you. Mr. I.H. young husband, MBCHB, FRCS, FRCSI. Bachelor of Medicine, Fellow of the Royal College of Surgeons of England. Dr. C. Doyle, B.Med., SIC, DM, MRCP. Bachelor of Medical Science, Doctor of Medicine, and member of the Royal College of Physicians. Miss E. English, MBBS, FRCS. Bachelor of Surgery, Fellow of the Royal College of Surgeons. Dr. E. Meriwether, BM, MD, FRCP. Bachelor Medical and Doctor of Medicine. Chapter 13. The Overseas Doctors. Type of registrations. To manage and treat patients in the UK, all doctors must register with the General Medical Council, GMC. There are several types of registrations. Provisional registration is for doctors who have just qualified from medical school in the UK or from certain European Economic Area EEA member states. Full registration is for doctors who have completed their year clinical training. Limited registration is for international medical graduates who have not completed the equivalent of year clinical training in the UK. Specialist registration is for doctors who have completed specialist medical training and have a certificate of completion of training, CCT. The GP register is a register of all those able to work in general practice in NHS. PLAB or PLAB. Before they can obtain full registration, some categories of overseas doctors are required to take the Professional and Linguistic Assessment Board (PLAB) test. PLAB is designed to ensure who pass can practice safely and the level of a HHO in a first appointment in a UK hospital. Part 1 consists of writing test knowledge, skills, and attitude. Part 2 is an objective structural clinical examination, OSCE. It consists of 16 5-minute clinical questionnaires, no attestation, to assess professional skills. PLAB, station and advice. OSCEIS assess the skill, clinical examination, your ability to carry out a physical examination of simulate patients, and actor trained to play this role will be assessed. Uncomfortable, or intimate examination will be carried out using a manicky and anatomical model. Practical skill. You will be assessed on practical skills such as suturing and giving intravenous injections. Communication skills. Your ability to interact with stimulant patients, or in some cases, the examiner will be assessed. The skill tests may include breaking bad news and giving advice on lifestyle. History taking. Your ability to take an accurate history and make and make personal diagnosis will be assessed. Advice on the station for an successful candidate. Read the instructions outside in the station carefully. You have 1 minute for this. Don't forget the ABC airways, breathing, circulation protocol in every emergency station. Keep in mind safety precautions like throwing in the sharp bin. Check the patient, understand what is happening, then ask them about any concept they may have. Don't just give a lectures. Listen carefully to what the actor says. El médico extranjero. Tipos de registro. Para tratar a los pacientes en Reino Unido, todos los médicos deben registrarse en el Consejo Médico General, GMC. Hay varios tipos de registro. El registro provisional es para médicos que acaban de calificar de la Escuela de Medicina en el Reino Unido o de ciertos estados, miembros del Espacio Económico Europeo, EEE. El registro completo es para los médicos que han completado su año de formación clínica. El registro limitado es para graduados internacionales de medicinas que no hayan completado el equivalente a un año de formación clínica en Reino Unido. El registro de especialistas es para médicos que han completado la formación de medicina especializada y tienen un certificado de finalización de formación CCT. El registro de GP es un registro de todos los elegidos para trabajar en la práctica general en el NH. Lab. Antes de que puedan obtener el registro completo, algunas categorías de médicos extranjeros deben realizar el examen de la Junta de Evaluaciones Profesionales y Lingüísticas, PLAB. PLAB está diseñado para garantizar que aquellos que prueban que pueden practicar de forma segura a nivel de un SHO en una primera cita en un hospital de Reino Unido. La parte 1 consiste en una prueba escrita de conocimientos y habilidades y aptitudes. La parte 2 es un examen clínico estructurado objetivo, OSCE. Consiste en 16 escenarios clínicos de 5 minutos, conocidos como estaciones, para evaluar las habilidades profesionales. Estaciones de consejos PLAB. La OSCE evalúan estas habilidades. Examen clínico. Se evaluará su capacidad para llevar a cabo un examen físico de un paciente simulado. Un actor capacitado para desempeñar este papel. Los exámenes incómodos o íntimos se llevarán a cabo utilizando un maniquí o un modelo anatómico. Habilidades prácticas. Se le evaluarán las habilidades prácticas como la sutura y la inyección intravenosa. Habilidades de comunicación. Se evaluará su capacidad para interactuar con su paciente simulado o, en algunos casos, con su examinador. Consejos sobre el estilo de vida. Toma, toma de historias. Se evaluará su capacidad para tomar un historial preciso y hacer un diagnóstico razonado. Consejo sobre, consejo sobre consejo sobre las estaciones de un candidato seleccionado. Lea atentamente las instrucciones fuera de cada estación. Tienes un minuto para ello. No olvides el protocolo ABC. Vías respiratorias, respiración, circulación en cada estado de emergencia. Tenga en cuenta la precaución de seguridad. Cómo tirar los objetos punzantes en el contenedor de objetos punzantes. Compruebe que el paciente entiende lo que le está diciendo. Luego pregúntele sobre cualquier precaución que pueda tener. no solo de una conferencia, escucha atentamente lo que dice el actor. Exercise 13.1. What kind of registration What kind of registration might this doctor obtain? Look at A opposite to help you. A newly qualified Spanish doctor. Provisional registrations. A newly qualified Nigerian doctor. Limited registrations. A doctor who has successfully completed the first foundation year. FY1 full registrations. An HHO who has successfully completed the foundation program and gaining a certificate of completion of training after several specialist registered posts, specialties registrations. Write the abbreviations in words. Look at A, B, and C opposite to help you. Any doctor who wants to work in UK must register with the GMC, General Medical Council. Someone overseas doctor must pass the lab test before they can register. Provisional and Linguistic Assessment Board. Part 2 of the test consists of the OSCE, Objective Structure Clinic. In any emergency, remember the EBC protocol, Airways Breathing Circulation Protocol. Before you can obtain a specialist registration, you must have a CCT, certifications of conventional training. Complete the test. Look at A, B, and C opposite to help you. My name is Musa, and I come from Jima. I come to UK before 2 years ago after graduating. Before Yemen is outside the EEA, I could only obtain limited registration with the GMC at first. It was very difficult for me to obtain a place of a foundation program. Although I speak good English, I had to take lab tests to show that I will work safely in the UK. If I had to give some advice to other candidates, I would be that and counseling stations. You shouldn't simple memorize a set of phrases. It's better to realize to really think about that you are saying to the actor and get the intonation right. After completing my year's clinical training, I was able to obtain full registration, but I found it difficult to get an HHO post in my chosen specialty. Pediatrics and hospital now have to demonstrate there isn't suitable candidate from the EEA. Once I've completed my second foundation year, I will obtain a CCT which will allow me to proceed to specialty registrations with the GMC, an important step of the board to becoming a pediatric consultant.